This is a 77-year-old patient in whom a first diagnosis of stage 3 lymphocytic non-Hodgkin's lymphoma was made in May 2015. No specific treatment was initially given. In June of this year, progression of the lymphoma was noted as well as a new, unclear space-occupying lesion in the pancreas. EUS-guided puncture was then carried out, showing necrotic and inflammatory material with no sign of malignancy. The CA19-9 level was unremarkable, and treatment with ibrutinib was therefore started. During the treatment, there was a very good response in the lymphoma during the course, with a continuing increase in the size of the space-occupying lesion in the pancreas. So a repeat EUS-guided puncture is now planned in order to obtain tissue material. It will be done by Mr. Will, accompanied by Mr. Bartet. The pancreatic head is inhomogeneous, and you can see inside the pancreatic head there are these hypoechoic structures, like this one here, but there are vessels going through them. It's not necrosis. The question is, what is it? He had pancreatitis, and we're not quite in agreement about what it is. And when you look, you can see this in the retroperitoneal area. It's located behind the pancreas, retroperitoneally. Maybe it's lymph nodes, retroperitoneal. And this is the pancreas. The pancreas is very inhomogeneous. And the question is, when I look through the pancreas now, I'm looking through it here. It looks like there are nodes in the pancreas, black nodes. One of them is at the back, here. And then here at the front there's another looser area, a heart-shaped hypoechoic area in the pancreatic head. We're not quite clear yet what it is. Up here is the bile duct, and you can see the bile duct isn't showing any alterations. It has a quite normal width, and the bile duct comes downwards and runs nicely through the papilla. But here there's a space-occupying lesion in the pancreatic head, without any swelling of the ducts. It's highly suspicious for lymphoma infiltration. Here's another lesion. There's a lesion here. There's one here at the front. There's one retroperitoneally down here. It looks very much like lymphoma. And now we'll move towards the papilla. Here we can see the pancreatic duct, down here. And look here. Now there's something hypoechoic inside the pancreatic duct. There's a space-occupying lesion developing here, but it looks completely different. It's a space-occupying lesion inside the pancreatic duct, probably infiltrating into the side branches here. Here we can also see little spheres, but they look quite different from the ones at the front in the head. The decisive thing is that the pancreatic duct in the body here is getting blocked up. The lymphomas here at the back are retroperitoneal. There's certainly nothing to do with this tumor, I think. So we would tend to focus on this tumor now. Here's the tip of the needle, and if I know that the needle is slipping off to the left in the image, I rotate my device to the right. Hold the space-occupying lesion there, go back and then go in again. And let's see if it's positioned better now. It's a little bit better. I'm taking the syringe with the vacuum and going through using a fan technique, and when I'm using the fan technique, I rotate the device rightwards. That means I force the needle to move it to the right. Now we're going out again. We can take the suction away from the needle and have a look to see if we've got any material. In the blood we can see whitish material. That's tissue.